After I did have the surgery, that was the beginning of, okay, wow, my eyes, I really look different.
When patients first come in, they come in because they have droopy eyelids and they see Dr. Justo. And if he recommends doing the eyelid surgery, I do the preliminary testing. Visual field is a test that tests your peripheral vision. So patients who have droopy eyelids often won't see superiorly, like above.
Now, blepharoplasty is a very, very common procedure, and I've performed 15 or maybe even 20,000 by now. I've lost track over the years. I started performing blepharoplasty back in my residency training in the 1980s, but once beginning private practice in 1989, I was one of the early adopters of the CO2 or carbon dioxide laser, and this has been a phenomenal benefit. It makes the procedure so much smoother, far less bleeding, and very comfortable for the patient and surgeon alike.
I had concerns about my eyelids. I felt like they were drooping, and I had a lot of difficulty with my makeup, and I felt like that it was starting to affect my peripheral vision a little bit.
So I educate patients on their preoperative and postoperative instructions for the eyelid surgery so they feel comfortable when they go into the surgery.
I can't imagine not having it now that I had the eyelid surgery. I can't imagine life before that anymore.
I, mustered up the courage to come on in and go through the door, and I'm glad I did, and I'm glad I had the surgery. It has been great. The experience was great. The confidence level after that has been wonderful. I feel better about myself.
In upper lid blepharoplasty, the majority of our patients are done strictly under local anesthesia, with or without a little touch of oral Valium to take the edge off. Yes, there's the occasional patient who confides in us that they're extra nervous or anxious, in which case we're happy to plan the procedure with a little bit of intravenous sedation administered by our anesthetist. Upper lid blepharoplasty is a very gentle and quick procedure, operative time taking only between 20 to 25 minutes. Once the redundant skin and fatty tissue is removed, then there's a little stitch or suture on the upper eyelid crease, which we'll take out the following week.
The surgery, it was just miraculous, because within, I think, the day that I had surgery, and obviously you're a bit swollen, but not overly so, I could tell the difference when my husband was driving home, that I could really, things opened up. So it wasn't like looking through tunnel vision.
Now, functional benefits of upper eyelid blepharoplasty are many, including increased peripheral vision, less tiredness, headaches or brow aches from heavy lids, better vision overall, and of course the most obvious is the aesthetic enhancement from not looking so tired.
So after the surgery, patients will come in and I will take their sutures out about 9 days after the surgery. That's the day that is the most rewarding to me, because I get to see how everyone looks and hear how happy everyone is with the results.
It made a huge difference. I recommend it. And in fact, when I was in here having my stitches out, one of my neighbors who I mentioned the surgery to had had the surgery 2 days after me. And he and I were checking out at the desk, talking about, hey, we can see, this is really amazing.
Lower lid blepharoplasty, in our practice, I always perform under IV sedation. With lower eyelid blepharoplasty, I make an internal incision on the inside of the lid using the laser. And that internal incision, because that is a mucous membrane and it's not skin, it does not require any sutures. The healing is very, very quick, and generally speaking, has very, very little bruising associated with it. Once we remove the fat pockets on the lower lid blepharoplasty, in many cases, but not all, in many cases I will do a light laser peel around the eyelids for a little extra rejuvenation and a little texturization of the skin. Thank you for your attention. Look forward to seeing you soon.